Hi, my name is Ashley Tucker. I am here to speak to you about how I was able to apply the four topic boxes to Miss Smith, a case that my ethical team and myself have been working on for a few weeks. I will discuss briefly with you her medical problems, her competencies, and her giving up or quality of life. And yeah, so let's get on to it. So, Miss Smith, just give you a brief background of Miss Smith is a 48-year-old white Caucasian single parent to an autistic child who actually needs her. Miss Smith has give you a little bit more background when it comes to her health. Miss Smith has indeed went through glutathione amputation, calciphylaxis. She has kidney problems. She is obese. Her hypertension. She's also diabetic. Well, I think one of the main issues here is the fact of where it all plays down to it, and that comes from her obesity. Well, my team and I decided that Miss Smith needs to be able to get those infections controlled, which is IV. Also, when it comes to her diabetes, I think that she needs to get on some oral medication to control that as well and find something that can actually help elevate her hypertension. Miss Smith also would need something for her. Well, she is a great candidate for a kidney transplant. This will actually help her quality of life. All of this, just getting on board with an infection, getting her infection cleared out and pain under control. Miss Smith is when it comes to her competency, she's not as herself right now. I think depression, her mental illness has also kicked in with her. She's not making the right decisions because why? She does not have the right support. Support is everything that we do not even think about when we going through procedures or being hospitalized. Just even for a day outpatient like Miss Smith, she had a brother that she thought was going to be able to help her and her son. However, that's not true. He actually got kicked out of the hospital. So now who's that gonna be for Miss Smith? I think it's Miss we would my ethical team and I would get around about the social workers to help her be able to survive a little longer. Giving up is not an option for Miss Smith. The reason why it's not an option, it's just simply because um, she got to have these treatments. These treatments will give her a longer quality of life for her and her son. The things that she's worrying about now would not be if she just go along with it, whether it's cost of her getting a prosthetic leg to actually carry on, but she can be able to walk if that's what she needs. But right now, Miss Smith needs to and have to figure to help improve her life. Her issue is she has to be obedient and being compliant with her physicians and her healthcare team that's actually is there for her to help her live a little longer. When it comes to contextual features and with Miss Smith, I think the only issues with that is how Miss Smith was very rude to some of the providers. Um, it can be a problem and it can also interfere with her treatment plan, but we're not going to allow that because that's against the law because the physicians all know and they all sworn in to make sure that they taking care of the best, well, take care of the best interest for the patient, having the best interest for the patients. um I think for myself, when it comes to real life cases, I think I didn't think about mental health or mental illness come about when a person is already feeling helpless. And when it comes to the quality of life, like Miss Smith, I think that I would, for now on, keep that in consideration. That sometimes a person may want and have the drive to um, want to be a compliant patient, but if they don't actually have the support and they need, whether it's coming from a family or a friend, but they definitely need someone to be able to speak for them. And in Miss Smith's case, she didn't have anyone, which is kind of sad. And because of this case studies I have in my own life with my parents and just my family members that live along on now, those are the questions I'm asking. So if you get sick or in the case of emergency, who's going to be there for you? Who would speak for you? we need to think about those things while we are in our great health, our great minds, where we are competent enough to make these decisions. We don't want to be like Miss Smith, who has no choice but to rely on her medical team. And I know it can be kind of hard when you don't know these people, but in her case or anyone else's case, you have to, they the only people you have to rely on. You have to go with them and put your trust in them. And besides, with them, and of course, God will lead the way. But that is my summary of this capstone project. Thank you. Have a great day.